So now let's discuss that why the left hand is preferred while recording the blood pressure and why not the right hand. So the short answer for that is that the left hand is given preference based on its anatomical difference and its importance as compared to the right hand. So now let's discuss why is that. So in the left hand, the subclavian artery arising from the aorta has a better angle, that is 170 degrees. So that is why it is more trusted as a source for checking or measuring the blood pressure. Aorta is the main artery that carries the blood from your heart to the rest of your body, and it has branches that go towards both the right and the left arm in the form of subclavian artery. But there is an anatomical difference in these both arteries. The right subclavian artery has an angle of 90 degrees, so the pressure is a little less here, as compared to the left artery, which has an angle of 170 degrees, which is a better angle, and that is why there is a better pressure in that artery, and this is why it is more trusted for accurate blood pressure readings. Furthermore, a comparison study was done to find the difference of pressures between both the left and the right subclavian arteries. A difference of less than 5 mm of mercury was found, which was considered normal. But in some cases where the blood pressure reading difference between both of them was greater than 10 mm of mercury, then it was considered diseased and was to be investigated for the blockage or constriction of the subclavian artery.